Thank you for having us, and thank you all for joining. We cannot do this without your participation. So this is a very common topic. Um, this is a topic that I often get questions about from pediatricians and primary care providers because this is often what leads families to seek treatment. And it's also a little bit difficult because it's not one specific diagnosis per se, but it's a clinical scenario that is very diverse in whom it impacts and what the reason is. So here's some of the things that we're going to discuss for today. We're going to talk about symptoms of school avoidance. We're going to talk about specific etiologies for it. What are the contributing factors towards it? We're going to talk about the impacts of school avoidance, both short-term and long-term. And we're going to talk about strategies that we can do within the primary care office and how to guide families towards um, adaptive treatments and treatments that could be helpful to address the underlying causes. So I like to think of school avoidance as signal anxiety. This is the behavior, this is the situation that finally compels families to seek treatment, that compels children to seek treatment. This is something that schools notice, that people from outside the family notice. So this is what finally kind of crosses the threshold of when anxiety becomes impairing. Now, school avoidance can take on many different forms, but at its core, it's a symptom of anxiety and fear. Now, the specific type of anxiety differs, and the person's response to it differs, but it's a situation in which the person is avoiding something else in addition to school, um, in most cases. And unfortunately, with the 2020 coronavirus pandemic, this has been increasing in prevalence. And school avoidance is not a formal DSM-5 psychiatric illness. It has other comorbid conditions, for example, social anxiety and panic disorder and generalized anxiety disorder, which are psychiatric illnesses, but in itself, it's not a DSM psychiatric illness, which can make it hard to research and study. So similar to what we said before, it's often complex and there's multiple causes for it. Now, it often depends on age, but one of the most common ideologies or reasons for why children engage in school avoidance is to seek attention from others. So whenever I see a behavior, whenever I see a symptom that a child or an adolescent's doing, I often ask myself, what is the purpose of this behavior? What is this child trying to achieve? Because children are not avoiding school without a reason. There's something they're getting or staying away from when they do not go to school. So one of the most common ones that I see in children younger than 10 is to gain attention from others. It is very closely related to separation anxiety. When I see a child younger than 10 avoiding school or becoming very frustrated or irritable in the morning when going to school or a drop off is very difficult, separation anxiety is something I have to rule out. So some common questions is, does child become upset when the parent goes off to the store and leaves the child with another adult at home? Does the child worry about the parent's safety? Does the child feel the need to protect the parent? And does the child have trouble going into a room or upstairs by himself or herself without the parent? Um, Oftentimes, especially in adolescents, adolescents avoid school to avoid interpersonal conflict. If there's a lot of drama at school, or if there's conflicts with teachers, if there's a lot of bullying or social media or teasing via social media, avoidance of school can be um, a goal of avoiding school. That's the goal of the behavior. And other times it can be they're getting something at home. A lot of times kids are becoming increasingly addicted to video games. So if they get to stay at home, they avoid schoolwork, which is stressful for them, but they can also engage in video games, read, be on a tablet, which they're not able to do at school. Another specific fear that they often avoid is tests. A lot of children and adolescents are worried about getting a bad grade on a test. So if they avoid school, they avoid the test, they avoid getting potentially a bad grade. Another situation that children and adolescents often want to avoid are social situations. Common ones are the cafeteria, the hallway, being called on in class. Those situations can be very anxiety producing for kids. And even though 80% of the school day could be fine, they'll avoid school if they feel nervous sitting in the big cafeteria and eating in front of a lot of other kids. What I often hear is that children and adolescents are nervous about their classmates taking photos of them or talking about them or posting something about them on social media. So if they avoid school, they can avoid that potential stressor. There are a lot of family contributing factors. I often like to say anxiety is the contagious psychiatric illness. We all have mirror neurons in our brain. So if we see another human being experiencing anxiety, we ourselves are more likely to experience anxiety. And behind a lot of anxious kids and adolescents is an anxious parent or another family member. There is often depression as well. And what I often see in these families is either an overdependent where family members are enmeshed and they have difficulty making decisions on their own, or they just feel comforted when they're with with one of their other family members, or they feel completely detached, which um, allows kids to feel isolated and not confident in their own ability. A lot of times people can have increased conflicts, and those who avoid school, this can be between parents, this can be between parents and other siblings. One, and this can contribute to school avoidance in many ways. There are children and adolescents who feel that they need to mediate conflicts between their parents. There are children and adolescents who feel that they need to support a sibling if he or she is in conflict with a family member, or they take on parental roles within the family. I've had a few high schoolers in families where the parents are experiencing either financial stress or medical stress, where the adolescent feels that he or she needs to be the adult in the family, cook meals for other family members, um, even try to do things like DoorDash. I've had a few juniors and seniors who felt like it was their responsibility to make income for the family. Um, Often poor communication styles can contribute to school avoidance if people either yell or they feel that the way to resolve conflicts is to avoid them. So if there's poor communication styles and the family can't work out problems and the family just avoids conflict by or avoids yelling by just avoiding the situation altogether, that becomes a model and that becomes a relationship style that the child then brings to his or her school relationships and his or her relationships with the teachers. And oftentimes, children who avoid school have families in which they have a very rigid problem-solving ability. So if people are upset about what restaurant to go to, fine, we're not going to go out to eat. Very simple solutions. It's not, hey, let's try to figure out a plan of, switching different restaurants every Friday night. And so everyone gets a turn to decide which restaurant to go to. It becomes an altogether, no, we're not going out, period. And that rigid problem solving can provide a background for children and adolescents to say, all right, you know what, this problem's really bothering me at school. The best thing to do is just avoid it. Not trying to come up with multiple solutions, not try to come up with work, or not trying to work with other people to develop a third or fourth solution. It's either all or nothing. So there's a lot of individual risk factors. If there's been a lot of drama or conflicts or arguments with classmates or friends, a lot of times a breakup with either a boyfriend or girlfriend, or just loss of friendships, or just feeling excluded from others. If people feel like they're had a friendship group and then they're the only ones who didn't get invited to a birthday party, that can sometimes precipitate school avoidance. Bullying is a big individual risk factor. We already talked a little bit about separation anxiety, but social anxiety is, I think, one of the contributing factors of why school avoidance is becoming much more common in the adolescent population since 2020. A lot more adolescents are used to being on a screen. A lot of social interactions are via texting or going on social media or FaceTiming, and interacting with other classmates and friends on a face-to-face basis can be a lot more new and a lot more anxiety producing for adolescents. Low academic performance can lead to school avoidance. They worry about not passing on to the next grade or not meeting their own internal or external expectations of their school performance. And a lot of times there are situations in which there's been a physical altercation, or there's been an argument with a teacher, or a teacher or another adult made inappropriate comments towards a student, which makes the student feel left out and outcasted at the school. And that can be a contributing factor to school avoidance as well. Some other individual risk factors: neurodivergence, autism, and ADHD are often comorbid with school avoidance. I've had a lot of children who've engaged in a perfectionistic mindset and not avoided school, and avoided school. They often tell me something along the lines of, well, if I can't get straight A's, I might as well not try.
So I had a
Because,
coming
go
mom
ahead.
say she's not a staff. She's one of the community partners that comes in as a
So could you
Sorry.
please speak up?
I think somebody just didn't have their microphone muted and had some background noise. Go ahead.
Oh, sorry. So they often say, hey, if I can't get a good grade or I can't get straight A's, I might as well not try than to risk trying and realizing that I didn't get everything perfect, or I didn't get everything good enough. Poor self-esteem can often lead to school avoidance if they don't feel as confident doing schoolwork or succeeding at sports or theater or ability to gain friends. And there's often poor impulsive and emotional control, and age can often contribute to the type of school avoidance. High schoolers are more likely just to drop off or drop out of school, where younger kids are more likely to avoid school at drop off and just have more irritability while at school. There are some environmental risk factors that can contribute to school avoidance. If there's a significant difference between a child's ability and the school's support and expectations, the child can feel inadequate and feel like they're not able to complete the schoolwork. So we often see this in children with specific learning disorders or another developmental disability that may not be apparent to the school, where due to their IQ or due to their achievement level, they're not able to do the schoolwork, but the school keeps saying, oh, you just got to try hard enough, or the parents say you got to try hard enough. And often I see this in many different ways, but if children feel like they're different, either in terms of coming from a different town, immigration status, race or ethnicity, if they have a different family traditions, they often feel that there may not be welcome. And unfortunately, there is still a lot of discrimination and prejudice that's still present in some schools as well and amongst some students. And that can contribute to a lot of bullying and feelings that the child doesn't belong in the school. And also, this is present in a lot of school districts where there's a lot of pressure to succeed academically, whether it's from middle school getting to a specific high school. We often get this with, let's say, Wilmington School of Charter. You need good grades in middle school to get to Charter School of Wilmington, or a lot of the VOTech schools have an admission process to Polytech and Hudson, where there's a lot of pressure to succeed academically to first get into the VOTech schools, but also stay within their preferred trade of the VOTech schools. I also want to make sure I go over the protective factors. Relationships is a big one. Kids are more likely to go to school if they have a friend that they know they're going to hang out with during lunch. Being part of school activities is a significant factor where they feel that if I get to school, I get to be part of the school play or I get to play in the game. And feeling that they're supported by family and that they have a rock or a stable home environment that they can come back to and feel like no matter what happens at school, I feel safe coming back home where I can just recharge and talk about how my day is with other people who are there for me to listen to me. Here's some of the statistics on school avoidance. It's equal between boys and girls. The most common age bracket is 5 to 11 years of age. That said, it's been increasing in prevalence amongst adolescents. So a lot of the older child adolescent psychiatrists who I work with said they used to never see that much school avoidance in the high school population, but now it's becoming increasingly common. So there are a lot of ways school avoidance can present, but more likely there is either a natural break in the school schedule or a precipitating event. It could be a bullying episode, it can be a failed exam, it could be something that happened at school, or it could be something that happened at home as well. But often the symptoms are slowly building up over time, and it's just not noticed by other individuals until they start missing classes. So just because someone started missing school a month ago doesn't necessarily mean that's when the symptoms started. The symptoms could have been present for a year or two beforehand. Here are some of the overall categories of symptoms. We're going to go into more of them specifically, but we have worrying, a lot of panic symptoms, feeling as if the walls are closing in, tearfulness, threats of self-harm, and especially in younger kids, somatic symptoms and temper tantrums, which are more externalizing behaviors. Children are more likely to engage in externalizing behaviors of anxiety and school avoidance, whereas adolescents are more likely to engage in internalizing behaviors. So here are some of the somatic symptoms of school avoidance. A lot of times this is the stereotypical, I feel sick, I need to stay home. So you can get dizziness, diaphoresis, headaches, shakiness that can often increase as the child goes to school, heart palpitations, chest pain. and also abdominal pain, nausea, vomiting, diarrhea, back pain, and joint pain. So, this is something that can be diagnosed over time. As the pediatrician, family care doctor, or the PCP, these families, these children, you kind of have a sense of their baseline. But when you start hearing about school avoidance, some specific things to ask about is, when did this first start, but what has been changing at school or at home? Also asking about academic difficulties, especially if there's a decrease in their baseline grade. So if someone's a traditional B student and becomes a C, D student, that becomes worrisome. Or if it's usually a straight A student and it becomes C's, that could be a signifier of when the anxiety started. Also asking about family relationships and, most importantly, their friends. What they like to do with their classmates. I often can get a sense of their peer relationships just by asking what he or she likes to do with their friends. If they're a teenager and they say, well, I sometimes get this, like, I don't really have friends, it's just people I talk to, or I have associates, I don't have friends, or I have some friends online. Those are indications that there's either social anxiety or they don't have that supportive friendship network. Some more objective data and information that could be helpful. Asking if they have an IEP or 504. Usually if a child starts struggling in school, a school might put a 504 in place. That's accommodations within the classroom. Bringing in report cards, and just asking parents, how many phone calls do you get from school? Especially in the elementary school range or preschool age range. If a child's feeling anxious and they wish they'd rather be at home and not at school, they're often reporting abdominal pain, trips to the school nurse, and their school just frequently calls the parent. So one way you can objectively measure progress is how many phone calls do you get from school. We also have truancy letters for more severe symptoms, and another objective measurement that can be accumulated over time is just attendance records. So asking the parents to bring in how many days of school do they miss for each month of the year. There are some more standardized forms. The two that are most easy to use is the child behavior checklist and the SCARE form. The teacher's report form is a little bit more intense. It takes 10, 15 minutes to fill out, and it has things like academic competence, anxiety, depressive symptoms, hyperactivity, and inattention, but that requires a little bit of training. But these two are free and available online. Especially like the SCARE form, because in a lot of EMRs, it's already built in, and it's a ready form that a lot of parents and other doctor's offices use. And the SCARE form also have a specific category just for school avoidance. So they have social anxiety, generalized anxiety, panic disorder, other anxiety conditions, but they actually have a category just for school avoidance. And then a BASC, which has a lot of anxiety school avoidance topics, but that's usually completed by the psychologist at school. Here are some of the comorbidities that occur with school avoidance. A lot of times, these things can accumulate over time. So for post-traumatic stress disorder, complex PTSD, major depressive disorder, a lot of these symptoms can have been present for a long time. It's just that it's getting worse, and now that it's impacting the child's ability to get to school. I often want to address the difference between school refusal and school truancy. This does have an academic difference, and because the treatments differ between the two. School avoidance, you usually get some psychiatric symptoms like anxiety, temper tantrums, depression, which are not present in truancy. Parents are very much aware of school refusal, which does not happen in truancy. Kids try to keep it a secret. So they'll go on the school bus but never enter the school. For school refusal, there's not usually any antisocial behavior present, but in truancy, there's often other items like teasing, stealing, being cruel to other individuals. And with truancy, they're often out and about in the community. They're not staying at home. And school refusal individuals are also more likely to be motivated to do schoolwork. So we're going to talk about some of the short-term impact of this. It really does impair academics, and this becomes a big conflict within the family. A lot of times these families are already struggling with communication and problem solving. That's one of the factors that led to the school avoidance to begin with. But now we have the situation where the child may feel like he or she's not being heard. Other individuals may not feel like they're being heard. There's usually other anxiety or family mental health concerns in the family. So parents and children just start arguing over going to school, and everyone starts feeling like they're powerless to help resolve the problem, which can lead to even more conflict. When children stop going to school, they stop interacting with other individuals, and they often feel that avoiding school is just another brick in the wall for why they feel like they're not good at things. A lot of times children, if they feel like they're not as good as at sports or at math, and then you add not going to school, that can also negatively impact their self-esteem. And overall, it leads to a decreased academic, social, and general functioning. There is a significant long-term impact. Kids that avoid school in elementary and middle school are also more likely to have poor academic functioning and underachievement in high school. Impacts their employment as an adult. It does lead to more risk of psychiatric illnesses and substance use disorders later on, because the relationships that they built up with other adults, teachers, and their classmates or teammates or theater mates at school can act as a protective mechanism against a lot of psychiatric illnesses. And just going to school itself, going through that social interaction, can help prevent and protect against other psychiatric illness. And you're also going to have an increase in suicidality and criminal behavior in those that avoided school at an earlier age. So now we're going to go into treatment. The biggest goal is early return to school. You really want to avoid avoidant behavior. One of the biggest contributing factors to school avoidance becoming truancy for a severe case of school avoidance is when children start staying at home. It's okay to do a very short-term letter for a few days if they don't go to school and they stay at home, but once they're at home or do at-home instruction for a few months, it becomes even more difficult to return to school. So decreasing avoidant behavior is one of the biggest treatment modalities. There's a lot of psychotherapies that are helpful. This is psychotherapy, I think, takes on a larger role than psychopharmacological measures. And then there's also environmental measures as well that the school can do. So we already talked about this. Please try as hard as you can to avoid home instruction and try to suggest alternatives. Trying to include all members of the treatment team, especially family members and the school counselor or the 504 team at school. And exposure to school setting is probably the best treatment for it. So there's a lot of psychotherapies that could be helpful, and this really depends on what contributed to it. If there's a lot of conflict with peers, and there's a lot of arguments, and the child or the adolescent oftentimes avoid school because they just want to avoid the drama, avoid a certain classmate, then dialectical behavior therapy could be helpful. If it's a child with a lot of separation anxiety and a lot of worries about parents, then CBT or family therapy could be helpful. If it's a child who has ADHD and they worry about getting in trouble at school, so because they can't control their hyperactivity and impulsivity, then not just treatment of the ADHD, but parent management training or behavior therapy could be helpful. If it's an individual with autism and they struggle or worry about their social interactions with other people, then social skills therapy can be very helpful. But part of all this is exposure therapy. There's more specific components that can be part of a lot of psychotherapies that are helpful for addressing school avoidance, one of which is just exposure therapy, imagining what it's like to go to school, writing or drawing out what it's like to walk in through the doors and sit through a classroom. If a situation arises, like the teacher calls on you, what can you say? So it's kind of like practicing for a play or practicing for a speech. You practice the situations and the child and adolescent feels more confident in doing it. A lot of relaxation training can be helpful. So doing something physical to help relieve the anxiety, especially the somatic symptoms. This can be progressive muscle relaxation, where you go from muscle group to muscle group and tightening them up and letting them go. Doing deep breathing techniques and grounding techniques also. The most common one is the 5, 4, 3, 2, 1 technique, focusing on 5 things that you can see, 4 things that you can touch, 3 things that you can hear, 2 things that you can smell, and if you have candy or something like that, 1 thing that you can taste. Other psychotherapy components include reward plan. If you get through 1 class period, you get 2 Robux, or you get an extra 5 minutes of screen time, or every class period you get this amount of special snack. And if you write it out in advance, that can be very motivating, especially in the elementary school plan. But it also can be helpful for adolescents as well. Had quite a few adolescents tell me, well, if I'm able to do this, then it's either some financial reward or I get to go out with my friends on the weekend. Working with parents is another big factor. You really want to focus on positive praise and reinforcing adaptive behaviors. A lot of times children feel like they're always being yelled at, they're always hearing about what's going wrong, but focusing on what's doing right can help increase that motivation and that self-confidence. Increasing structure within the home and improving communication between family members. Sometimes just even scheduling a time in which everyone can get together and just go over what needs to go done can be very helpful. A lot of families eat meals separately. There's a lot of after-school activities that sometimes impacts just times in which the family's together. We already talked about social skills and problem solving, but cognitive restructuring is a strong or a big component of cognitive behavior therapy. A lot of times, children or adolescents will have automatic thoughts of when they attend school. So it's, oh, if I go to school, everyone will be looking at me. Or if a teacher calls on me, I'm automatically getting it wrong. And there are ways to challenge those thoughts. This is often done with a therapist, but asking a child, all right, name all the times in which that's true and name all the times in which that's not true. Or what's all the evidence for this thought or against this thought. And when the child writes them down, they can see, oh, wow, this thought that first popped up to my mind may not actually be true because look at all the friends I have. Look at all the questions I got right. Here's all the success I've had in school. And problem solving is often part of social skills training as well. So a lot of times asking to play with a friend during recess for elementary school or asking to sit next to someone at the cafeteria table, it sounds straightforward, but this can be one of the biggest roadblocks in attending school. So there's a lot of school accommodations that people can do for school avoidance, one of which is a graduated return to school, going to one period the first day, going to 2 periods the next 2 days, going to 3 periods on days 4 through 5. Like having a graduated schedule can be helpful. Either a counselor or a coach or a specific teacher that can walk in with the student can be very helpful. Just as long as you get over that hump of getting in through the doors can be very helpful. Having preferred school activities. I've had some schools for elementary school kids have Lego time with the school resource officer or someone else at schools that's saying, okay, hey, if you get through the morning, you get 30 minutes of just your own individual preferred activity to try to get them into school. And a lot of schools allow children and adolescents to take breaks. So they have like a flash pass in which they can step out of the classroom and go to a specific room in which there's not that many other people, or it's just more of like a lot more schools are having meditation rooms or just quiet spaces where they can just stay away from stressful situations. So as I mentioned before, a lot of schools can have rewards. A lot of times the bus is very, very challenging. The bus is often where a lot of teasing and bullying happens. You get kids from different age groups or different grades, and the child's captive without that much adult supervision. So you have to stay on the bus for either 10 minutes or 45 minutes, and someone could be sitting behind you or behind the child and teasing the child without any adults knowing or intervening. So sometimes schools make adjustment to classrooms. They match two friends up together, or the two children that are in conflict with each other get adjusted. And also they can have school lunch at a different time too. I know when a few adolescents have missed school due to anxiety, they often have lunch somewhere else in the school. And there's a lot of state interventions and school interventions for bullying and teasing. So this is a lot of the stuff we've already covered, but most schools have a counselor or a psychologist or a therapist. I know all the public high schools in Newcastle County have a school-based health center or a wellness center in which there's a therapist. More and more schools are having a lunch bunch where it's a teacher or counselor sits with students who have trouble with anxiety during lunch with that social situation. I saved this for last because although this can be very helpful, I do like to think of it as an adjunct for the psychotherapy. I think the psychotherapy is what's more helpful, but you definitely want to treat comorbidities if it's severe enough with an SSRI, includes anxiety, panic, depression. And it's just helpful in general as empiric treatment for severe and chronic school avoidance. If SSRIs are not helpful, there's buspirone or an SNRI that could be helpful. Here are the as-needed medications. I sometimes have used this to great impact. Hydroxyzine can be helpful for short term, for a few months, but I wouldn't recommend it for longer than 3 to 4 months, in part because these side effects can build up, such as constipation and dry mouth. I've seen a few kids develop cavities because of prolonged hydroxyzine use led to dry mouth, and which led to cavities. And for some high schoolers, older adolescents, and it's severe school refusal and school truancy court is pending, and it's starting to risk child protective service involvement with the parent due to missed school. I often say it's okay for very short-term treatments. No more, I usually don't give any more than 5 tablets of very low dose of Klonopin just to get them into school. But I've used this rarely, and to put into perspective, in the last 3 years, I've prescribed a benzodiazepine 3 times for school avoidance. So I only reserve it in severe situations and only in older adolescents. So here are some of the concluding thoughts about it. I really want to emphasize the avoidance or avoiding the avoidance of school refusal, and trying to emphasize exposure therapy and early return to school as much as possible, and working with the family members and with the school as well. So thank you so much.